Top 20 paramedic interview questions and answers. Are you preparing for a paramedic interview? If so, we have done the legwork for you. Below find the commonly asked questions and their best answers. 1. Why are you interested in this role? The interviewer asks this question to find out whether you are passionate about the job. Share what you are passionate about in this role, such as the impact you want to contribute to the job. Sample answer. My compassion for people makes me feel satisfied being a paramedic. When I see people suffer from different conditions such as accidents, fire, and other illnesses, the more I feel that this is what I was called to do. I am passionate about helping people live better lives. Seeing people walk out of emergencies and being able to live a normal life drives me to desire more to work as a paramedic. It gives me pleasure to use my knowledge and skill to make the world better for the patient. 2. What are the roles of a paramedic? The hiring team wants to ascertain whether you are aware of the duties of a paramedic. Describe the roles of a paramedic as you connect to the job at hand. Sample answer. Paramedics perform many roles such as responding to emergency calls, staffing or driving emergencies vehicles, dressing wounds, diagnosing patients, administering medication, using specialized equipment, among others. 3. What are the qualities that a paramedic needs to be successful? This question seeks to determine whether you know the qualities that make a good paramedic. In your response, ensure to list a few traits of a good paramedic and connect to the job at hand. Sample answer. A skilled paramedic must be able to operate effectively under stressful situations, work long shifts, communicate well with patients, maintain professionalism, make quick and informed decisions. Additionally, a paramedic should possess strong interpersonal, problem-solving, and critical thinking skills. 4. What major challenges did you face during your last role? How did you manage them? The hiring team wants to find out whether you have problem-solving skills. Describe one of the scenarios you consider as a challenge, explain how it happened and how you managed it. Sample answer. As a paramedic, I have responded to different types of emergencies such as fires, accidents, etc. Most of these were like a routine. However, one day we received a call to go and respond to a shooting in a place that was being controlled by street gangs. They did not want us to be there. Knowing that the victims depended on us to live, we had to go anyway. While we were attending to the victims, the gang members showed up and there was a huge tension. Luckily, the police arrived and they guarded us as we attended the victims. 5. Describe your daily routine as a paramedic. The hiring manager will ask this question to gauge how you prioritize your work. Demonstrate that you are focused on work and that you are organized. Sample answer. I begin my day by inspecting my rig to ensure that I have everything I need for my shift. After I am done with inspecting, I stay at a waiting point at the hospital for any call. If there is no call coming in, I will do other tasks such as staffing or driving emergencies vehicles, dressing wounds, diagnosing patients, administering medication, using specialized equipment, among others. 6. Describe briefly about your experience. The interviewer wants to determine whether your background matches the need of their company. In your response, describe that you are the best fit by summarizing your work history as you link it to the need of the company at hand. Sample answer. I am passionate about helping people in emergencies. Previously I have worked as a paramedic in a hospital setting for 3 years. My responsibilities included responding to 911 calls to attend to patients who need wound bandaging or cardiopulmonary resuscitation. I would also assess the condition of a patient and administer treatment or first aid depending on the magnitude of the issue. 7. What kind of strategies and mindset is required for this role? Your response to this question will help your interviewer to find out your attitude toward the job. Illustrate that you are excited to perform the job by indicating the strategies and mindsets you will hold as you perform the job. Sample answer. Every paramedic needs to be aware that it is very crucial to give the right diagnosis to patients regardless of the situation. They, therefore, need to be dedicated and extra careful when treating patients. Paramedic stands between the victims and death. This requires them to be quick problem solvers and swift responding to patients' needs. The job of a paramedic is quite demanding and may require one to work odd hours and off shifts. One must therefore prepare to work under pressure yet produce excellent performance. A paramedic must be mentally and physically strong to be able to perform duties effectively. 8. What is the biggest challenge that you foresee in this job? The hiring team wants to determine whether you are well familiar with the industry and if you can handle any challenge that may arise in the future. Demonstrate that you are knowledgeable with the current changes, and should there be any challenge, you are prepared to manage it. Sample answer. The major challenge I foresee in this job is that the mental health of the paramedics may be affected. This is due to fatigue, long shift, and making critical decisions under pressure. The paramedic, therefore, needs to receive training on how to take care of their mental health. I received on-job training on coping and maintaining an emotional balance, and I can share this knowledge with other co-workers should I be hired. This may reduce the trauma that is associated with the nature of work done by the paramedic. 9. How do you stay motivated in your work? This question seeks to determine what you value while working as a paramedic. Highlight some of the values and interests you hold regarding this job. Sample answer. Doing what I love to make me stay motivated. It gives me satisfaction to know that I make a huge difference in the world using my skills, education, and expertise. This is what gives meaning to my life. Caring and showing empathy are my nature. It gives me much joy to care for victims in their most vulnerable situations. 10. Describe a time when you failed in this role and the lesson you learned. This is a question that seeks to determine whether you admit your mistakes and learn from them. Share a real situation that you failed in and the lessons you picked from it. Sample answer. When I was new in this career, I was called to respond to an accident that had involved 2 public service vehicles. It was such a faulty accident that led to the death of 7 people. I had not responded to such a traumatizing event before. I became emotional and started crying, being unable to assist the living ones effectively. Luckily enough, another co-worker arrived and together we attended to the victims. We administered first aid on him and took them to the hospital to examine him further. We ensured that there was no other life that was lost. This event was horrific and stressful to me at first. However, I have learned to set boundaries and not to personalize cases. This has reduced the trauma load in my work, and I can respond to any event knowing that my services are needed to save lives. 11. Why do you feel you are the most suited for this role? The interviewer asks this question to find out more about you. This is the time to prove that your personality, traits, skills, experience, and education matches to the need of the company. Sample answer. I am a self-driven, critical thinker, problem solver, and physically fit individual ready to work in a challenging environment under minimal supervision. I hold a bachelor's degree in medicine. Previously, I have worked as a paramedic in a hospital setting for 4 years. In the course of working, I have also received other on-job training that has helped to improve my skills in this industry. I am very flexible and I can work under pressure. My duties involved responding to 911 calls to attend to patients who need wound bandaging or cardiopulmonary resuscitation. I would also assess the condition of a patient and administer treatment or first aid depending on the magnitude of the issue. Given a chance, I will use my competence, skills, education, and experience to make this role a success. 12. Share with us your greatest achievement. The hiring team wants to gain knowledge about your proven work and which accomplishments in your career are most valuable, according to you. They want to get insights into who you are and how you approach your work. Sample answer. My greatest achievement was when I was called to respond to a fire tragedy. I was new in this career and my ability to work under pressure was key in this role. Upon arrival, I realized that many people were trapped in the building. I alerted the firefighters on the same. Chaos began since the members of the public were impatient and they thought that we were being slow in this mission. It became difficult to do the operation. We wanted to save as many lives as possible, if not all people. I called the reinforcement of the police, who came immediately and dispersed the crowd. When the crowd was controlled, we were able to do our mission effectively without losing any life. However, 2 of the victims were in critical condition and were rushed to the hospital using our ambulance. They later became stable. This was one of the most successful missions I have attended to. 13. How can you stop bleeding in case of an accident or patient suffering from injuries? The response you provide will help to show your experience and training level. Demonstrate your knowledge about treatment procedures, ability to follow protocol, and familiarity with immobilization practices. Sample answer. I would begin by ensuring that the scene is safe. I will then go ahead to attending the patient. I will examine the patient's airway, breathing, and circulation. Then, I would treat the bleeding. I am aware of the pressure point where I can apply direct pressure to stop the injury site from bleeding. I will check for any secondary injury. The next thing will be to immobilize any fracture using a traction splint. I would continually keep treating for a shock as we transport the patient to the hospital. 14. What extra precautions must you take as a paramedic when responding to a crime scene? The hiring team asks this question to test your knowledge of special precautions one needs to take at a crime scene. Demonstrate that you can create balance when stabilizing and treating a victim to the best of your abilities as you preserve any potential evidence. Sample answer. First, I would ensure that the scene is safe. Then, I would begin to treat the victim, being careful not to touch weapons and other suspicious items in the vicinity. Additionally, I will record the patient's position on arrival and report that to the hospital. I will also report other crucial observations to the hospital. 15. What are the different types of environments you have had to work in as a paramedic? This question seeks to determine whether you are experienced in the areas that the company works. As you respond to this question, be honest and avoid exaggerating your capabilities. Align your response to the needs of the company. Sample answer. I have worked in urban and rural areas. I have experience responding to events in city streets, ethnic neighborhoods, high-rise buildings, and rural areas. I am comfortable working in any type of environment. 16. Tell us about a situation where you followed specific rules and procedures. This question helps the hiring team to understand whether you can follow prescribed procedures. You should be ready to share such a situation based on your experience as a paramedic. Showcase your ability to follow strict procedures. Sample answer. In my training as a paramedic, my professor emphasized that we ought to follow procedures. Following procedures keep us safe as well as helping us avoid conflicts as paramedics. Recently, I received a call requesting that we attend to a patient. However, that patient wasn't in a critical condition. I could have ended the call quickly, but I didn't. I followed the protocol even though this needed more time and effort from me. I didn't want to violate the hospital's policies or else fall into disciplinary actions. I had to do what was right. 17. Explain how you can deal with a drunken and abusive patient. The interviewer wants to know whether you can deal with drunk and abusive patients. Demonstrate how you can handle the situation. You can relate to an incident where you did this if you have ever handled a similar case. Sample answer. I have found myself in such scenarios countless times. I have responded to calls from drunk patients. They can be passive at times, but in most cases, they are very abusive and combative. However, my strong communication skills help me to calm them down so that they can cooperate. Sometimes I call law enforcement in case a patient proves to be so hard to cooperate with. Even though I don't like involving law enforcement agents, sometimes I find it important for my safety and that of the patient. 18. What do you do to maintain and update your skills as a paramedic? The hiring team wants to know if you are well familiar with the current trend in this field. Demonstrate how you stay current with your skills and certifications while performing your job. Sample answer. As a paramedic, I often spend myself training. Besides training to maintain my certifications, it helps me stay sharp in my skills as well as learning new ones once they become available. I always participate in departmental training programs, including taking the required classes. Additionally, I research to familiarize myself with new developments in this field and emergency services. Whatever knowledge I acquire, I use it to become more effective in my work. 19. What comes into your mind when you hear the term nebulizer? The hiring team asks this question to know if you are familiar with respiratory conditions and how you can effectively respond to respiratory emergencies in this field. Project your knowledge of the conditions that require the use of a nebulizer and showcase when it's indicated for those conditions, including the medication commonly administered using the device. Sample answer. A nebulizer is a device used to administer medications, such as albuterol, to the lungs in the form of a mist. It's used to help patients with COPD, cystic fibrosis and asthma. 20. If you get hired, explain what you will always carry in the job as a paramedic. The interviewer asks this question to determine if you know the tools that a paramedic should have at all times. The best strategy to respond to this question is to list the key things you should carry when responding to an emergency. Sample answer. As a paramedic, I will ensure that I carry an ambulance identification card, blank notepad, pen torch, drug dose reference card, and a pair of protective eye care. I will also ensure that I have an access to app for language translator and medical dictionary.